Hello everybody, my name is Neil Savage. I'm the Director of HR and Organisation Development at Gloucestershire Health and Care NHS Foundation Trust. And I'd like to just share some of my thoughts and experiences of reciprocal mentoring. I've been a member of two schemes. The first one was in a different health region before I joined this trust. And the most recent one was GHC's scheme, which we launched just before COVID, December 2019. Had a little bit of a bumpy ride on that because of COVID and various other factors, but managed to follow that through with a reciprocal mentee-mentor until 2022. So I think I've found reciprocal mentoring a really great opportunity to listen and to learn from other people's experiences and life circumstances, and to be able to then use that learning to inform my own thinking and practice in workforce, human resources, organisation development, learning and training and so forth within the trust, within my role. And I think I'd add that the experiences have certainly helped me to inform some of the decisions, some of the behaviours and practices of what I do, and they've also contributed to thoughts on policies and procedures, particularly in terms of the Agile Working Toolkit, Agile Working Policy that we developed through COVID and which is now being used across the organisation. I'd say that reciprocal mentoring certainly helps if you're looking for a better understanding of what it's like personally, culture-wise, behaviour-wise, job, career-wise, coming up through the organisation. I've heard from people really with very different life experiences and backgrounds through both my scheme experiences about what's good, what's average, what's not so good, the warts bit, what enables people to enjoy working and progressing, and what presents obstacles. And sometimes learning about those obstacles has been really quite impactful on me. I find out new things that I probably wouldn't have thought of or considered by that experience. I've personally had some great feedback from my mentors, and it's been necessary. It's not always been easy, but I've also been able to give some good career signposting and feedback and ideas myself to the colleagues that I've been on the schemes with. So all in all, I think if you want to challenge your thinking, if you want to get some different, fresh thinking and views, I would strongly recommend reciprocal mentoring. As a concept and a practice, it's one of a number of key enablers to good workforce strategies and practices, good leadership, good management, particularly I think in terms of helping to progress talent within the organisation, potential managers of the future, etc., clinical and non-clinical, alongside really helping to progress some of our strategic ambitions on equality, diversity and inclusion, which is really, really critical to how it feels, how it feels to work in an organisation, as tested out by staff survey and things like that. So I'm really pleased to be joining this new cohort, and I hope that colleagues that are also joining up get some really great mutual support through the programme. I hope to catch up with some of you personally and hear stories, but enjoy the scheme, and we'll see you soon. Cheers.